$8. That is what a bottle of rosemary oil costs at Walmart. It does not slow hair loss. It does not mask the thinning. It regrew hair permanently in a 2015 clinical trial that tested it head-to-head against the most prescribed hair loss drug on the planet. The result was identical. Same hair count, same regrowth, fewer side effects. Rogaine costs $50 a month and requires daily application for the rest of your life. Rosemary oil activates the same blood flow to your scalp for an $8 bottle that lasts months. Ancient Egyptians massaged this oil into the scalps of pharaohs to prevent hair from thinning. You have stood in front of the mirror watching your hairline retreat. You have typed your symptoms into Google at 2 in the morning. You have walked past the Rogaine shelf and done the math. $50 a month, $600 a year for a product that only works as long as you keep paying. The hair loss treatment market generates $9.5 billion a year. They did not stop using rosemary because it failed. They stopped talking about it because it worked too well. This is the story of rosemary oil and the industry that buried it. The hair loss industry generates $9.5 billion a year globally. It is projected to hit $21 billion by 2034. Johnson & Johnson owns Rogaine. Merck sells Propecia at $150 a month. Hair transplant surgeons charge $15,000 per procedure. Every revenue stream depends on you believing hair loss requires an expensive ongoing intervention. An $8 bottle that regrows hair permanently is not a product they can sell. It is a product they must ignore. And what you are about to hear is the reason they needed you to never find out. In the next 10 minutes, you're going to learn the exact molecular reason rosemary oil regrows hair, the year the industry decided to ignore it, the specific dose that changes everything, and the step-by-step protocol that costs less than $2 a month instead of $50. Stay until the end. Step 3 is the one that separates the people who get results from the people who quit too early. Welcome to the vault. If these stories matter to you, the subscribe button and the bell are the only way to make sure you see it. Here we open the ones the industry thought were sealed forever. Now let me take you back to where this all begins. An Egyptian servant kneels behind a pharaoh, pressing warm oil into his scalp. The oil is extracted from a woody shrub that grows wild along the Mediterranean coast. The Egyptians believed it stopped hair from thinning and restored what had already been lost. The Greek physician Dioscorides catalogs the same plant 1,500 years later in De Materia Medica, the most influential medical text in Western history, and prescribes it as a remedy for the scalp. 2 civilizations, 1 coastline, the same plant for the same problem. That is not tradition. That is evidence so consistent that the convergence itself becomes the proof. But here is where the story takes a very dark turn. 2 Italian chemists, Scarpatti and Oriente, walk into a laboratory in 1958 and isolate the primary active compound from rosemary for the first time. They call it rosmarinic acid. They publish their findings. For the first time, the compound the Egyptians trusted has a molecular identity, a structure, a formula, a name. And what happens next should make you furious. Nothing. For decades, rosmarinic acid sits in a chemistry journal, while pharmaceutical companies pour billions into synthetic hair loss drugs. A young dermatology resident named Gwynter Kahn notices something strange at the University of Miami. His patients taking an oral blood pressure drug called minoxidil are growing hair on their arms, their faces, their backs. Kahn reports the side effect. Upjohn, the company that makes the drug, does not see a problem. They see a product. They reformulate minoxidil into a topical and get FDA approval in 1988. They brand it Rogaine. By 1992, sales hit $200 million. Rogaine becomes the gold standard, not because it was the best solution, but because it was the one a company could patent. Then, in 2015, a team of researchers does what the industry never wanted done. They put rosemary oil in a clinical trial against minoxidil, head-to-head. Same patients, same timeline, and the result threatened everything the hair loss industry had built. But that is not the worst part. The worst part is what happened after the results were published. Stay with me, because what comes next is the part that costs the industry $9.5 billion if it goes mainstream. Your hair follicle has a built-in self-destruct switch called DHT, dihydrotestosterone. When testosterone converts to DHT through an enzyme called 5-alpha reductase, it binds to your follicle and slowly strangles it. The follicle shrinks, the hair thins. Eventually it stops growing. That is what 66% of men experience by age 35. Minoxidil does not touch DHT. It opens potassium channels in blood vessel walls to increase blood flow. That is its entire mechanism. Stop applying it and the hair falls out again. Here is where the math gets devastating. Rosemary oil does both. 12-methoxycarnosic acid, a compound inside rosemary, showed 82% inhibition of 5-alpha reductase. Finasteride, the pharmaceutical gold standard, achieved 81%. Same enzyme, same rate. And rosemary simultaneously increases blood flow to the follicle through 1,8-cineole, the same vasodilation mechanism as minoxidil. The 2015 PANAHI study, published in SKINmed, tested 100 patients. 50 received rosemary oil and 50 received minoxidil, 2%. The trial lasted 6 months. Both groups showed the same significant increase in hair count with no statistical difference. The rosemary group reported significantly less scalp itching than minoxidil. You now possess the same clinical evidence that Johnson & Johnson and Merck have been sitting on for over a decade. That is exactly why they cannot afford for you to know this. Now, here's the part that should make your blood boil. You cannot patent rosemary oil. United States patent law says you cannot monopolize a substance that exists in nature. You cannot create a subscription model for it. What cannot be patented cannot generate recurring revenue. This makes rosemary unpatentable. Johnson & Johnson sells Rogaine for $50 a month. It only works while you use it. Stop paying and the hair falls out. That is not medicine, that is a subscription. Merck sells Propecia for $150 a month with side effects that include sexual dysfunction. In 2012, over 3,000 men filed lawsuits against Merck, claiming Propecia caused permanent sexual dysfunction even after they stopped taking it. The FDA forced a label change. Merck kept selling it at the same price. 3 years later, the PANAHI study proved an $8 oil matched their competitor with 0 sexual side effects. Merck never released a statement. A permanent $8 solution is not a revenue model. It is an existential threat. The industry's answer is not to use rosemary oil. It is to repackage it. Sephora sells a rosemary scalp serum for $60. Amazon is flooded with serums at $30 to $45. The active ingredient is the same oil you can buy for $8. They add jojoba, a label, and the word serum. The chemistry is identical. Your hair follicle does not read the packaging. 5-alpha reductase certainly does not. If you have made it this far, you already know more about rosemary oil than 99% of the people paying $50 a month for Rogaine. Subscribe and share this with one person who is watching their hair thin and wondering if there is another option. Every share is one more person who gets to run the numbers. Now here is exactly what to do. It is almost insultingly simple. Step 1. Buy 100% pure rosemary essential oil. Walmart, Amazon, any health store. Make sure the label says rosmarinic officinalis. $8 to $15 for a bottle that lasts 3 to 4 months. Step 2. Mix 3 to 5 drops of rosemary oil into 1 tablespoon of carrier oil. Jojoba for oily scalps, coconut for dry scalps. Never apply rosemary oil undiluted. It will burn your skin. Step 3. This is the step that separates results from frustration. Massage the oil into your scalp for 5 full minutes, not 30 seconds, not a quick rub. 5 minutes of firm circular pressure. Most people who say rosemary does not work never let it reach the follicle. Leave it on for at least 30 minutes. 2 hours is better. Then wash with mild shampoo. Step 4. Apply 2 to 3 times per week, not daily. The PANAHI study used this frequency and it matched daily minoxidil. More is not better. Daily application causes scalp irritation. Step 5. Wait 6 months. The clinical trial showed no change at 3 months. Results appeared at 6 months. Most people quit at month 2 because they expect instant results from a protocol that works on a different timeline. The people who make it to 6 months are the ones who see regrowth, $2 a month versus $50 a month. This will not reverse complete baldness where follicles have permanently closed. Rosemary oil works on thinning hair and early stage loss where follicles are miniaturized but still alive. Rosemary matters for early intervention. A teacher in Knoxville, Tennessee. He was 41 years old, thinning since 32. He used Rogaine twice a day for 6 years, which cost $3,600. His wife found the Panahai study online. He switched to rosemary oil on a Saturday morning. By month 3, nothing visible. By month 5, his wife noticed the crown filling in. By month 7, his barber asked what he changed. $2 a month. $2 was in the essential oil aisle the entire time. An Egyptian servant pressed rosemary into a pharaoh's scalp 3,000 years ago. In 1958, Italian chemists gave the compound a name. In 2015, a clinical trial proved it matched the most prescribed hair loss drug on Earth. And in 2026, millions of men are still paying $50 a month because no one can patent a plant. Patent status explains a lot. The knowledge was never lost. It was repriced out of your awareness. Knowledge was made expensive. Rosemary does not expire. 5-alpha reductase does not check insurance. A plant that has been growing along the Mediterranean for thousands of years has never charged a licensing fee. Licensing is not part of nature. Your grandmother knew about this. She did not need a prescription. She did not need a monthly plan. She did not need a pharmaceutical company's permission to keep her hair. Grandmother knew practical remedies. Every pushes this past the algorithm that buries it. Every share puts this back in the hands of someone still paying $50 a month for a solution that stops working the moment they stop paying. The next vault opens soon, and what is inside is going to make a very different industry very nervous.